Welcome to DFW Business Hour. It's an outreach program of Webb Chapel Church of Christ. I am Mark Garcia, your host. We thank you for joining us, and today we have Michael A. Battaglia, independent agent, specializes in health, life, disability, and long-term insurance for self-employed individuals, small businesses, and families. Michael, welcome to DFW Business Hour.
Welcome, Art. I appreciate it. I appreciate your invitation to come out and talk today about insurance. I think it's an important topic.
I know you have a busy schedule, but it's a pleasure being able to talk to you. I was going to ask you, with hundreds of insurance agents out there, what makes your services better than the others?
Well, I'll tell you, it's interesting. The health insurance market, at least, is shrinking because of some of the pressures put on us by Obamacare and stuff. But my main focus is really on customer service, in providing needs analysis and helping people put together full packages and understand how all those pieces work together. I don't just go out and send out quotes and then see what happens. I work with you to find solutions.
So if a person is looking for insurance and they call you, you actually go to them. Well, wherever they're at, their location.
And that's correct. We like to sit down with our clients. We don't just do things over the phone. So we go out to them. It's more convenient for them. It's in their setting. They may need some information. So we either go to the house or we may meet them at a Starbucks, and we help them make the right decision on their insurance.
Great. How many years of experience do you have as an independent insurance agent?
Well, I'm in my fifth year. I've owned my own agency for 2 of those years.
Great. Many people never see the doctor or use medical services. They are young or healthy. Should everybody get health insurance?
Yeah, I think that's really important. Everybody gets health insurance. People see health insurance a little different than other insurances. They think that it's meant for everyday use, and it's not. Insurance is really there for the big things. If you're young and healthy, you still need it. A case in point, I met a 26-year-old guy. It was right before Christmas. We talked about insurance. He said, look, I want to get through Christmas before I buy insurance because I want to give my family some gifts for Christmas. And of course I said, well, you know, health insurance is a great gift. Unfortunately, he didn't buy it at that time. Came January, when he was ready, well, he was diagnosed with colon cancer, and he had no insurance. So these are the types of things that we got to make sure we're insuring for those major things that would catastrophic. It's not about doctor appointments.
Okay. If someone does get health insurance, does it cover everything?
Well, it depends on the insurance you have and the way those things are put together. Major medical is going to cover any of your types of stuff like that. There are areas sometimes like mental health isn't covered all the way, and so there's different holes in different insurances, and so you really need to work with an agent to find what those are and make sure that they meet your needs.
You do both group and individual insurance. What's the difference between them, and why should someone get one over the other?
Well, group insurance, of course, is going to come through an employer. If you're a small business, you have 2 people, you can still buy group insurance. But group insurance is what they call guaranteed issue. So it doesn't matter what your health condition is, they have to give you insurance. They can rate it up, and there's some things that happen like that. Where individual insurance is what they call fully underwritten. So you go in as an individual, the insurance company will go through your medical history and they'll set your rate based upon that. You can end up with things like a rider that says we'll cover everything except for, or you can end up with a little higher rate, or you can be declined and say, I'm sorry, I won't give you insurance. That doesn't happen with group.
Okay. What about a self-employed person? What should they do?
If you're self-employed, you really want to go to individual insurance. You don't want to get on your spouse's group policy. I know that's tempting a lot of times. A lot of times it's cheaper not to. But the main thing that happens there is group health insurance doesn't cover you while you're working. Okay, that's what workers' comp is for. So if you're on your spouse's health insurance and you're out working, you're a realtor and you trip and you fall down the stairs in a house, your health insurance won't cover that because you're on the job, and on the job isn't covered on group. So you really want to make sure you get some individual insurance. Okay,
great. Currently, people that have pre-existing conditions have problems getting insurance. What should they do?
Well, it depends what those conditions are. Sometimes you can work through the insurance company and get coverage. You know, if you've been cancer's been in remission for 3-5 years, you usually can get insurance. If you can't, there's a couple of areas where we can help you go to. There's the Texas Risk Pool, which is a place you can get insurance with pre-existing conditions. There's also now the Federal Risk Pool. Federal Risk Pool, though, you have to kind of be uninsured for 6 months, so it really just depends on your situation.
I see. Well, healthcare reform has had a number of changes already. What are they, and have they helped?
Yeah, there's a number of changes in healthcare reform that have come into place. Some of them are great. There's no more limitations annually on your insurance. It used to be it would only pay for $3 million or $5 million worth of coverage. Very, very, very few people hit that, but they're gone. Things like you can keep your child on until age 26. I haven't found this help a whole lot because most kids, it was cheaper to put them on their own policy. But there's some cases if you have multiple kids where that's helped. Another one is preventative care. Some insurance covered that without deductible or copays. Some didn't. Now all insurance has to cover that. So if you go in and you have your annual checkup, your mammogram, your pap smear, your colonoscopy, all those things now on the new plans are covered at 100%, no deductible, no co-insurance. And I think that's a pretty good thing because I think preventative care matters a lot. There's some other stuff that's caused, sounds great, but it's caused some issues. A good example is children under 18 cannot be declined anymore. Okay, in 2014 everybody would be that way, but right now it's just children under 18. As a result, health insurance companies now don't do children-only plans. Okay, it used to be about 33%, about a third of the time you wrote a child-only plan. Insurance companies said, well, if we're taking all these kids who could be sick, we can't do that as children only, so now you have to have an adult on the plan with them. And that's caused some problems in the industry.
I see. Also, what about the new HHS contraceptive mandate? What's your take on that?
That's a real interesting one. There's a lot of talk about that being a freedom of religion issue, which I think it is. But when I look at it from an insurance point of view, it makes no sense to me as why it's put in. Let's start here.
Okay.
Preventative care, health insurance does two things, right? It covers you in case of some medically necessary event, right? So I don't cover cosmetic surgery, but I do cover accident. Or it does preventative. And what is my preventative? It's I have a mammogram to stop breast cancer. I have pap smears for cervical cancer, flu shots to get rid of the flu. Yeah. Somehow we've put now contraceptive coverage into there. So I guess what we're trying to say is that now pregnancy is a disease that needs to be eradicated. And that doesn't make sense to me. The other thing about it is the World Health Organization has classified contraceptives as a class 1 or group 1 carcinogen, same class as a cigarette smoking, because it causes cervical cancer and it causes breast cancer. So now we're turning around and saying for women's health, we're going to give them some sort of cancer-causing drug in order to eradicate pregnancy. And when I look at that, it just doesn't add up to me. And I think that's one of the problems you get in with single people making decisions about what insurance companies are going to do. It really changed just the whole dynamics of health insurance.
Okay, what does the future of healthcare reform look like?
Well, it's obviously up in the air. We've got an election coming up. Yeah. Some people think it's going to be repealed completely. I don't think that's possible at this point. I think there's too much to unravel. Do you get enough people in Congress to vote and everything else? I do think it's going to take some radical changes, though. But we got to kind of live with what we have right now. And as we go forward, in 2013 is a big transition year. If things stay in place very long, companies have got to start planning for the fact that it's coming. 2014 is the date all these things get implemented. So as an individual, as a company, you got to start looking at this and planning for those. But personally, I think there's going to be some changes in it. I don't think it's going to go completely away.
I see. What would you like to see in the healthcare reform?
Well, you know, I'd like a lot more focus on cost reduction. This was the Affordable Care Act, and what you realize when you look at it, it really just dealt with health insurance companies and reforming health insurance companies. It did nothing. It did nothing for cost containment. And there's a basic problem you have when it comes to health insurance, health care and costs, right? Everybody says, oh, they're rising so fast, and you know, how do we contain those? And they give lots of reasons. And I haven't heard the right reason, because if I look at it and I go, if I look at cosmetic surgery and if I look at LASIK surgery, okay, both have got the same dynamics as regular healthcare, right? They got expensive equipment they have to buy, they've got liabilities with insurance, those types of things. And those aren't rising. And so you ask yourself, why? And you realize that there's market dynamics going on. There's a true supply and demand going on in that marketplace. What happens when we have health insurance in is we've got this third party out there. So you have a doctor and you say, okay, well, who's the supplier? Well, the supplier is the hospitals and that type of stuff. But who's the consumer? And suddenly you don't know who the consumer is, right? And there's this disconnect. Is the doctor the consumer? Probably, because I don't remember the last time I said, hey, you know what, I think I want an MRI, right? The doctor tells me to go get the MRI. And so what we do is we have the doctor and the insurance, and we have this three-party thing. So the doctor never sees the bill, so he doesn't care, right? The insurance company doesn't have a say in what happens. And as a patient, we go, oh, I'll go get my MRI. I don't know what it's going to cost. I don't look around and shop. So what I'd like to see is something in healthcare reform that gets the consumer more involved. There's things like HSA-type policies that puts a little more burden on the consumer to do some shopping and put some skin in the game. And when the consumer puts skin in the game, suddenly, you know, I'll look for that MRI. You know, if I go to a hospital for that MRI, it's $2,500. If I go down the street, it's $500. Well, as a consumer, I'm going to go to the $500.
Exactly.
And so if I can put things in healthcare reform that fixes that the relationship between supply and demand, then I can bring down costs. And when I do that, then I can start seeing some changes in healthcare.
Okay, along that note, what is healthcare reform? Do you think that it will work? Why or why not?
Well, okay, healthcare reform came into place a couple years back, right after President Obama came in. You know, one of the first things he did spent about 2 years putting in a 2,000-page document that kind of set in motion this whole stuff. And the idea was to solve some problems. You know, we talked a little bit earlier about how pre-existing conditions you may not be able to get health insurance. It's supposed to solve that problem, among others. And of course, that was put into place a couple years ago and is now working its way through the system. I think in the long run, if it stays intact as it is now, like we said before, it doesn't do anything about cost containment. What you're going to see now is a pressure of rising prices, rising premiums over the next 10 years, and pretty soon it's going to be a push to become a government takeover because we can no longer afford it. And then we're going to be kind of in the Medicare problem that we're in today, where we're running that into bankruptcy, and that becomes an entitlement. I think it's just too big. Okay,
what are the tax breaks for small businesses, and are they being used?
Yeah, one of the things they put in place is a tax break of 35% for a small business on buying your health insurance. Now, that sounds great, but you got to look at some of the dynamics of that particular tax break. First off, you have to be in companies of 25 or less. You have to have an average pay of less than, I think it's $15,000, and then as you move up to $25,000, that tax break drops. So you've got to have something that you've got kind of unskilled workers in, so that you can have a low enough average pay in a small enough company. And what they're finding is that not many people take advantage of it. And the ones that do, they've made the paperwork so hard that everything that they save, the CPAs and the accountants are taking to fill out the paperwork. And so it's become kind of this no-win game. And it's one of those things with healthcare reform. Sounds great, but isn't being implemented well.
Okay, what new taxes does healthcare reform have in it?
There are so many taxes. There's 23 new tax in healthcare reform. I can't remember them all off the top of my head, but to give you an idea of some, I mean, now if you go to a tanning booth, it's going to cost you 10% more tax. Okay, but some of them even make less sense. There's a tax on pharmaceutical companies, which obviously going to be passed on to us, which is going to raise the cost. Same thing with durable medical equipment. You buy crutches, you buy wheelchairs. Those companies are being taxed at a higher rate to pay for it. Well, of course, again, passed on to us. There's a number of other taxes. A good one is capital gains on unearned income. So if you've got an IRA and it's building money, that unearned income, the rate of taxation is going to go up another 2%, 2.5%. Which is going to take more money away from you, again, to pay for health care. So there's a lot of these hidden taxes that's out there that people just aren't aware of, and that are going to start coming into play. And there's some other ones out there just like that.
Okay, do the parts already implemented work?
You know, some of them do. Look at people who get preventative care. It's nice most of the time. There's some pieces that don't work as well. For instance, a colonoscopy. If you go in for a colonoscopy and they find no polyps, nothing happens, then that's preventative and everybody's happy and it costs you nothing. If they do find some and they take them out, it no longer is preventative. So when you go in for that procedure, you really don't know if it's going to cost you, whether it's preventative or not, till you come out. But more importantly, there's other ones. We talked earlier a little bit about the kids with pre-existing conditions. Okay, I've yet to see this help a child. What happens is the insurance companies can charge up to 800% more for that child. So if a child's $100 and they've got cancer, they're going to be $800 a month to insure. I'm not going to pay the $800 a month. I can go to the risk pool for $300 a month. So that kid with cancer, I haven't helped at all. He's still going to the risk pool. On the other hand, I now can't have child-only plans. So you're a single mother, you're working in a company, it costs you $50 for your insurance, and it costs you $400 to put your child on your plan. Well, I can insure that child for $100. So that mother used to come to me, I used to write a plan for that child, it saved her $300 a month. Well, I can't do that anymore. So what ends up happening is that single mother who now has this one child is paying that $300 a month. Another case you see that same thing. A lot of times you have during a divorce, unfortunately, somebody has to buy insurance. They're court ordered. I had a lady call me up and say, "Look, I'm getting custody of my child. My husband had some problems. The courts told me to do that. I must put insurance in place." Well, she's uninsurable, self-employed, so she can't get insurance. If she can't get insurance, I can't get insurance for that child. So now I look at the court and you go, okay, I can't get insurance. What do I do? There's not child-only plans. Now, there is a secondary type of insurance that's not major medical. It's called an indemnity plan, a fixed indemnity plan. Doesn't give you a whole lot of protection, but I had to put the child on that. So here I've had to take and put a child on an insurance policy that wasn't great because of these other children that aren't going to help. So we see some things in the law like that just have got these unintended consequences, you know, going on. And I run into that, unfortunately, way too many times, and that bothers me about the healthcare reform.
Okay, I have another question. Why does the cost of healthcare keep going up, and what should be done about it?
Yeah, we were talking a little bit about that before, right? Yeah. There's this whole idea of the supply and demand not working right in that whole healthcare reform, and you know, there are these things that I sell an awful lot of them. They're called health HSA accounts or HSA plans. And they're a little different. The government says, hey, if you set up this HSA, take one of these qualified plans, then we'll allow you to take these tax deductions for your health care expenses. And they work really well. Now, some things work a little differently. For instance, you're not going to have co-paid doctor visits on it, right? You're going to get network discounted, and you're going to take a little more risk on your everyday doctor visits. Well, that goes right to what we're saying with the supply and demand. What you find in those policies is they don't have the same rate increases year over year that the other ones do because the consumer's involved with them. So I'm thinking that, you know, we can always use taxes to change behavior to what we need. So asking, you know, taking policies like that and maybe giving tax breaks on premiums that meet certain qualifications allows us to get the consumer more involved. Look, everybody goes to the doctor. Let's be real about this. We should take control of our health, not the doctor. You know, when I go into the doctor, especially today's internet environment, I go in with questions, I go in with reports. He tells me I got an issue, I go out and study it, and then I have a conversation with my doctor. And I go, does this make sense? You know, that's the type of thing we need to be doing. And even here's a trick for your viewers. Medicine's expensive, right? Yeah. So I get prescribed, I don't know, Singular, and I got a 10 milligram dose, right? And it cost me $120 to buy that prescription. Okay. I can ask my doctor to give me a 20 milligram dose and take half a tablet. Now, the cost for the 10 milligram is $100. The cost for the 20 milligram is $110. So if I cut that pill in half, I just cut my prescription cost in half. So we need to be working as consumers to start making better decisions about how we're going to do our health care. We have to take responsibility for that. Exactly.
Where can people contact you for more information?
They can always go out to my website. It's the easiest way. It's www.InsureYouToo, and that's InsureYouToo.com. They can reach me on my phone, 972-832-4494, or by emails, michael@InsureYouToo.com.
You also have a Facebook page.
Yes, I have Facebook and Twitter, and I tweet out things about the industry or ideas or tips and that type of stuff. Love to have you join my Facebook, which is @InsureYouToo.com. And my Facebook is obviously Facebook/InsureYouToo.com.
Well, Michael, thank you so much for dropping by DFW Business Hour, and thank you for all the useful information that you gave us on insurance needs so people can get a hold of you. You're the man to go to.
Well, I appreciate the time, and look forward to talking and helping anybody we can.
Well, Michael, have a great day.
Thank you.